today's society, obesity is a very large problem. My study focuses on one aspect of obesity, and it's non-alcoholic fatty liver disease. We wanted to find a way to battle this in a more natural sense. So we chose curcumin, a product of the ginger family, and supplemented within the mice diet. Our hypothesis was that curcumin within this diet could decrease overall liver inflammation, congestion, bile duct hypertrophy, and vasculitis. Our model was a leptin-OB knockout mice. Leptin is also secreted from the fat cells, or adipocytes. It goes to the hypothalamus of the brain and tells your brain you've had enough to eat and you no longer need to consume food. So for our methods, we used 20 OB leptin knockout mice, 10 in our control group, 10 in our curcumin treated group. In the control group, they were just given 9 grams of food per day, while in our curcumin treated group, they were given 180 milligrams per 9 grams of food. Overall, they were fed for 60 days, and then on postmortem collection, we had the liver sectioned in H&E stain, and then our histopathologist read it blinded. So he was not well aware whether we were doing the control group versus the curcumin treated group. We also then collected the serum blood to test for inflammatory cytokines, glucose, and overall liver enzymes. So moving on to our results. There is no significant difference between the in-body weight or in-liver weight. So curcumin is not a magic pill to reduce overall obesity. However, moving to our histopathology, we had our greatest significance. Overall liver inflammation, liver congestion, bile duct hypertrophy, and vasculitis were significantly decreased in our curcumin treated group, showing that this could possibly reduce a lot of inflammatory products that a non-alcoholic fatty liver disease releases into the body system. Overall percent liver fat was significantly decreased as well, showing that maybe curcumin could treat some of the NASH pathology behind creating all this fat deposition within the liver. We chose an ELISA test for inflammatory cytokines. We tested for interleukin-6 and TNF-alpha. There is no significant difference in the interleukin-6. However, there is a significant decrease in the TNF-alpha, showing that reducing the inflammatory cytokines reduces the overall inflammation. We also chose to test for the superoxide dismutase. This is a powerful antioxidant system within the body. Our hypothesis was it could be increased in the curcumin treated groups, showing that that's why we have additional anti-inflammatory methods behind curcumin. But overall, we found that there was no significant difference, showing that this is maybe not the reason why curcumin has powerful anti-inflammatory mechanisms. Now finally, we did find something very interesting we weren't planning on. Overall, the blood glucose level in the curcumin treated group was significantly increased. We have some mice over 360. Compared to the untreated group, our highest one was not even over 240. We're not sure if curcumin is to blame for this or if it's another mechanism we're not aware of yet. Finally, moving up to some images, we have our untreated versus curcumin treated group. In the untreated group, you see a lot more of that clear space. That represents the adipocytes within the hepatocytes, or that fat backbone. The curcumin supplemented group, you have a lot of that pink parenchyma, much healthier, and a lot of that less clear spaces, meaning less fat. Moving on to these images now, the red arrows point to the vessels, and you can see they're much thickened and they have a lot more dark cells. Compared to the black arrows go towards the bile ducts. Again, you see it's very thickened in the untreated group, and then much thinner and a lot less of those inflammatory cells in the curcumin treated group. So overall, curcumin was found to have a great benefit on the liver, and especially within non-alcoholic fatty steatosis. It reduced overall liver inflammation, congestion, bile duct hypertrophy, and vasculitis, without any measurable side effects to the study. One of the weaknesses of this study was that it was a leptin knockout mice. It's not an exact replica of obesity itself within a human model. However, since it's a leptin knockout, they kept eating and eating until they became obese mice. So it kind of translated well, but we need further trials to see if curcumin really can be a benefit of non-alcoholic fatty steatosis.
My name is Monika Shukla, and I did my project on the variability and non-surgical management of brachial plexus palsy with Dr. Robert Rinaldi at Children's Mercy and Ms. Andrea Melgerson, occupational therapist. So the objective of my study was to determine the variability and non-surgical management of brachial plexus injuries amongst 23 clinics across the United States, and to determine which therapeutic modalities are most commonly used and encourage the standardization of treatment. What we found was that there's lots of variability amongst the treatments and therapeutic modalities that we can use, most commonly aggressive regimens are to use splinting, neuromuscular electrical stimulation, and constraint-induced movement, as well as return of optimal function with the use of Botox to alleviate co-contractures in the joints.
My name is Brandon Elder. I'm a fifth-year medical student at the University of Missouri, Kansas City, and this is my study, the MCP-IP1 deficiency in unregulated inflammatory disease. Just to orient us, there's a well-accepted notion that the root of many diseases that plague mankind find an origin in inflammatory disease and changes therein. It's a very complex cascade of mechanisms from point of stimulation to point of response. And one of those proteins that we have identified is the monocyte chemotactic protein-induced protein 1 of the zinc finger family. In previous studies, we found grave systemic consequences in deficiency of this particular protein, as seen here in the previous studies, where we have normal granulous or normal lymphocytic tissues that lose complete organization and eventual function.
My research topic was ovarian cancer, and one of the reasons we chose to research ovarian cancer was just because it is the fourth leading cause of mortality for women in the United States, and the leading cause of mortality among all the gyn cancers, which is a pretty big deal. So one of the things, with any research that you want to address is a problem which we identified as ovarian cancer, and so the purpose of our research was to identify an easy way to find those people that have ovarian cancer. Typically the pattern with ovarian cancer is that most women are not found until they have widespread metastases and they're at a late stage and a poor prognosis for their disease. So we wanted to identify a way to find these women early on. So,
hi, my name is Arfaa Ali. I'm a Year 5 medical student, and my research is on the effect of omega-3 fatty acids on leptin knockout mice that I did with Dr. Betty Herndon. So the basis of the research was the effect of omega-3 fatty acids on leptin knockout mice, which are actually models for non-alcoholic hepatic steatosis. And the basis of the research was using 2 groups with 10 mice each that are all leptin knockout mice. One was treated with omega-3 and the other was not, and we looked at their liver pathology. But what was unexpected was that 5 mice out of the 10 in the treated omega-3 fatty acid group actually died. So this kind of made a turn in our research, but I'll first present the original results that we found with the liver pathology. So here is the results of the liver pathology with the untreated liver and the treated liver. And we saw that with the treated group with the omega-3 fatty acids showed significant improvement in the liver pathology as far as the inflammation.
Alright, my name is Hirak Shah. I'm a fifth-year medical student at UMKC. The project I talk about today is a point prevalence survey of antimicrobial usage at a children's hospital in 2011-2012. My mentor is Dr. Jason Newland, who's an infectious disease doctor at Children's Mercy, and he's also the director of the Antimicrobial Stewardship Program, which helps oversee all antibiotic usage at the hospital. So just a brief introduction about this topic. As we know, antibiotics are one of the most commonly prescribed medications in hospitals everywhere. And as we continue to prescribe these medications, resistance is at an all-time high. In fact, when we look at we talk about in microbiology the so-called doomsday, where bacteria will soon be resistant to almost every kind of antibiotic. We're actually closer to that day than we think. In fact, in Toronto, they've actually isolated strains of Neisseria gonorrhea that are resistant to almost every known oral antibiotic. And so antimicrobial resistance is one of the most important issues today, and this is why I'm very interested in the topic.
Hi, my name is Parikh, and my presentation today is on the distribution and function of polycystin 2 calcium channel receptors, or channels, within the retinal ganglion cell. And so what the polycystin 2 is a channel that is both voltage dependent and calcium dependent. And so the function of it has been established in other tissues in the human body, such as in the kidney, liver, and other places like that. However, no research has been done to establish its distribution and function in the retinal ganglion cells, which is surprising because this channel, the polycystin 2 channel, is involved in systemic conditions such as polycystic kidney disease and things like of that nature. And so my research is just to establish the baseline of that, and so in hopes to provide more information to go on to establish other disease processes.
My name is Ramya Kollipara and I'm a 6th year.
I'm Chetna and I'm also a 6th year, and we're going to be talking about the phenotype of hormone-related allergic and autoimmune diseases of the skin and their annular lesions at lab fairs. And Colleen Reese is our faculty who has been sponsoring us.
So it's long been known that women are more predisposed to autoimmune diseases of the skin and of various organs as well. And so the goal of our discussion is to correlate those autoimmune diseases to the skin and via that to the ovarian physiology. So we have 4 cases that we saw in the derm clinic. The first one is a 40-year-old female who had common pustular psoriasis, and she had significant improvement after 3 months of therapy with norethindrone or contraceptive pills. And then the second case is of a 19-year-old female with alopecia who also had improvement after norethindrone and metformin. And the third case is alopecia as well with improvement after norethindrone and metformin. So these cases illustrate that there's obviously a link between ovarian physiology because the skin lesions improved after the hormone-based therapy to the immune system and via that to the skin. So if you look through the literature, there's lots of correlation between the immune system and how it differs in males and females. So in females, the adaptive immune system is regulated via different immune cells, like CD4 cells, CD4 Th2 cells, and B cells, versus in men where it's more controlled via CD8 cells and then CD4 Th1 cells.
Hi, my name is Katie Nichols and I am a 4th year medical student at UMKC, and this is my project entitled Normative Pupillometry Data in Healthy Pediatric Patients from 1 to 17 years of age. And I worked on this project with 2 faculty members at Children's Mercy, Dr. Brown and Dr. Neville. I'd first like to start off with some background information. As you may know, it can be very difficult to assess a child's state of pain as well as analgesic response, so we're looking for better ways to assess a child's pain. Asking a child what's your pain on a scale of 1 to 10 can be subjective and the child might not understand that, so we're using a handheld device called a pupillometer, seen here, to capture pupil size and reactivity to light, and we're hoping to use that as a biomarker for pain in future studies.
Hi, my name is Denesh Natrasingham and I'm a 3rd year medical student. So I'm going to be talking today about mild strokes. Dr. Greensberg is a physician and a professor of neurology at Harvard School of Medicine, and he states that it's difficult to find patients who would agree that mild strokes are unimportant. In fact, you could almost argue that there's no such thing as mild strokes, that all strokes are significant. And I agree with that, and that's what this research is about. Most hospitals in the United States measure strokes using the National Institute of Health stroke scale, which ranges from 0 to however severe a stroke is. When it comes to mild strokes, however, the most research shows it's between a 0 to 5. The main problem with these patients between 0 to 5 is that there's this idea of whether we should give IVTPA or not. And when it comes to giving IVTPA, the intravenous tissue plasma inactivin, which breaks down the clots and reduces the symptoms of the stroke, many people feel that this is an aggressive treatment.
My name is Lisa Bask, and I'm a Year 5 medical student at UMKC School of Medicine. And my mentor was Dr. Betty Herman, and my poster is Angiotensin 2 and its role in fat embolism-induced lung pathology. This study is part of an ongoing study in determining how angiotensin 2 impacts fat embolism lung pathology, which typically follows long bone fractures and orthopedic procedures. And the effects that most are intractable can have on this pathology. And so, some background on this is initially we had Turleen injected into rats, which was used as a fat embolism model, and the lungs that were introduced with Turleen showed some smooth muscle cell proliferation. There was a lot of inflammation, septum congestion, as well as collagen production in Turleen exposed lungs. And there was also observed the effect of losartan and captopril on these lungs, and it was shown that they decreased the pathology. And angiotensin II was implicated as a possible mediator of this pathology, and losartan and captopril were mitigating factors. And so my research basically is to determine angiotensin II peptide levels in trilline-treated rats using ELISA. And so what we started with was about 16 rats, and they were injected with the trilline. And the rats were euthanized at 24, 48, and 96 hours, and their lungs were harvested. And captopril and losartan was also introduced into some of these rats, and they had and they were euthanized at 48 hours. And then, so my project involved grinding the lungs and then using C18 columns to isolate the peptides, and then using ELISA to see the peptides. And then, so what we found was that captopril and losartan had increased amounts of peptides in the lung.
Hi, my name is Felicia, and I work with Dr. Harper and 5 other professors on my project in quantifying the extent of human papilloma quadrivalent recombinant vaccines in a safety net population. So my vaccine, as most people know, HPV-4 vaccination, you need 3 doses to get a good effect for HPV 16 and 18. So the primary purpose of our study was to quantify the wastage of HPV-4 in a safety net care system, and to determine the predictors of wastage by HPV-4 dose to guide future cost-effective prevention programs.
Hi, my name's Josh Williams. I'm a third-year medical student. I did research on weight estimation in children with Down syndrome. Dr. Nazreen Talib, Susan Rahman, and Jenny Rom, all affiliated with Children's Mercy. What we did is we wanted to look at weight estimation methods in children with Down syndrome. Weight estimation methods are used when you don't know the weight of the child because it's a trauma situation, or maybe it's a third world nation where there's no scales available, but you still need to know the weight for dosing medications or something like that. So these different weight estimation methods have been created based on different anthropometric or demographic variables. What we did is, they'd never been tested before on children with Down syndrome. So what we did is we tested them on children with Down syndrome. We enrolled 286 children in the Kansas City area, and we measured their length, weight, humeral length, mid-upper arm circumference, and age with qualified raters. Then we plugged all that data into these 5 different methods and compared them, estimated weight versus actual weight, to see how they did.